We will bring the highest quality vascular access clinician to you at your bedside where treatment is best.
Vascular Wellness is your turnkey solution, beginning to end of vascular access. Vascular Wellness is a mobile vascular access company, but don't let that confuse you. Other mobile vascular access companies in the market in this area tend not to have hospital clients. Their credentialing process is very different than ours. They may be competencied in 10 sticks, and that's it. We are upwards 50, 75 successful procedures before we sign someone off, and we are looking and going to each nurse every year biannually to do a skills assessment and competency. So this is something that we stay ahead of. The credentialing process is the setup part.
So one of the things that we're able to offer customers, I think, that is really important to them is that everybody that works with us are our employees, okay? And because they're our employees, we are able to control not only their onboarding process with us, but we're able to control the training that they go through. We're able to control the experience and exposure they have to the different procedures, so that when we have a clinician who becomes competent in a particular area, they are competent in that area. We know that every time that we send a clinician out to address a service call for one of our clients, that they are making sure that they provide that client with the level of service and the level of quality and the level of safety that patient deserves.
If you just provide a great device, that's not enough. If you just provide good customer service, that's not enough. In order to really be of benefit and of service to your client, you have to provide the human resources, the excellent employee package that they've gone through drug testing and background checks. You have to provide policies and procedures that back up all the clinical actions you do. You have to provide excellent customer service. You have to provide a pleasantness to the being pleasant to the staff nurse who may be frustrated with everything that's going on, and you have to be that reassuring voice that comes and says, "Hey, no worries, we're going to take care of this." You have to provide to the physicians that you are a reliable, trustworthy source for vascular access. If you are not the whole package, I would encourage people not even to be involved with this. You have to be able to recognize that patients need better outcomes. Hospitals need to be assured that you're providing a professional service, and it's an all-encompassing service that you provide.
The patient comes first in every aspect of the decision-making of this company, from the leadership team all the way through every rank and file of the organization. And to me, that was a totally different element. So on the leadership side, we're making decisions, and at the pinnacle of that decision is what outcome we deliver for the patient.
We are our own independent group that has all the right devices that anyone would want put in their mother. And that was one of the early concepts of this company, is that if we felt good about putting this device in our mother, then we'll feel good about doing it in a patient. And that's kind of like what used to be an unofficial motto, like, are we doing the right thing for this patient? And I felt like since our inception, we have never looked for the cheaper way out, the cheaper way to do things. Everyone gets an antimicrobial device. There's no law that says you have to do that, but it's the right thing to do for a patient. Every midline gets a max barrier drape. Many people place midlines without max barrier, but there is a difference in your infection rates if you do max barrier drape. So I feel like we've taken a lot of pride in doing it the right way versus the shortcut way.
I'm really, really proud about is our innovation. We are not just PICC nurses. We're not a transactional company. We invest and spend time and money in pushing the envelope to advance healthcare and empower nurses. That's our slogan, advancing healthcare and empowering nurses, and we live by that. How do we do that? We have a full-time director of research and development. We spend time with the local nursing boards of North Carolina, South Carolina, and the other territories in which we serve. We interact with the Joint Commission. We do these things to see what else we can do to serve healthcare, to serve our patients, to serve our clients by improving outcomes and reducing costs. That is how we ended up in the world of small bore 8-10 years ago. That is how we just launched a new program on temporary dialysis catheters, or Vas Cath dialysis. And we have other things in the pipeline that are just as innovative. We develop these procedures, we speak to the nursing boards, we get their approval, and we're the leading cutting edge in this area. We are the best of breed solution in the Southeast.